Okay, here we are with the WD-40 stretch. And basically that stretch is going to be for the knee that's causing your most pain. And 9 times out of 10 what happens is that there tends to be a band of tension around the bottom of the knee. And this band of tension gets really tight and it'll be up your leg. And what we're looking at is it's your IT band, and that's the iliotibial band. It goes from your ilium, which is your hip, all the way down your leg to your tibia, which is the bone in your lower leg, the main bone in your lower leg. And what happens is when that tendon gets tight, it will rotate your leg out. And you'll see a lot of the videos on the internet that'll talk about rolling out that band of tension with a foam roller or a tennis ball or a lacrosse ball or something like that. And that, of course, is going to work. However, it tends to hurt, and it tends to hurt pretty bad. So I'm going to show you a stretch that this WD-40 stretch that is designed to lubricate all of that, to really take the tension off of the nerves in your knee that are getting squeezed in your knee joint that are contributing to your chronic knee pain. So what I'd like for you to do is get a hold of the lower part of your leg, and you're going to take your leg and you're going to rotate it so you get a good firm grip, and you're going to rotate the bottom part of your leg out. So you're rotating it towards your outside hip. So if you're doing it on your right leg, you're going to rotate it to the right. And if you're doing it on your left leg, you're going to rotate it to the left. And what I'd like for you to do is just hold it in this space for 30 seconds to a minute. That's all you need to do. And after 30 seconds or a minute, you're going to let that go and walk around a bit and see if that has changed any for you. The idea with this, the philosophy of it is that instead of stretching that tendon or stretching that sore point, what you're doing is you're taking the pressure off of that by rotating the leg out more. Kind of like two negatives make a positive. And when two negatives make a positive, you involve your nervous system, and you get your nervous system to reset and let go of that tension on its own, so you don't have to fight it to do so. So what I'd like for you to do is go ahead and do that stretch for me. Take your 30 seconds to a minute, rotate your leg externally. Let me know how it goes. Shoot me an email, bill@thekneepainguru.com, and tell me what you noticed, what you experienced, what happened as a result of you rotating that leg externally. So cool. Well, thank you so much. Remember to keep an eye on your inbox. Over the next week or so, I'm going to be sending you several videos like this that's going to educate you on those different topics I talked about in the previous video, which is, bone on bone, arthritis, degenerative changes, ACL, MCL, PCL surgery, meniscus issues, kneecap issues, all of that I'm going to cover in subsequent videos over the next week, and I'll explain to you how my program, how my approach can help with those types of situations. So thank you so much, and I will be in touch soon.